Hi, good evening everyone. I'm Caroline, an expert OET trainer from IILT. Welcome back to another speaking live session. It's been a while since I came for a live, and today we are going to look into a case note analysis, which is not just a case note, it is an exam model cue card discussion itself. And if you ask me when was this question asked, I would say it was asked for last time, like the previous exam, which took place in the month of February. So it's kind of like a model form that I have made for you. It's not the exact same format, but I kind of like made these tasks and arranged in their background information and details, which will fit into the kind of the same model that was asked for the examination. Okay, so I thought it will be more easy for you guys to prepare for exams as well, because if you get more exam model question papers, you will be able to understand what type of questions will be asked and what type of tasks can be expected as well. Okay, and when it comes to today's session, I've actually made the transcripts here. Okay, that's the reason why I'm having the thing on the display. So normally what I do is I show you the case note and I give you time for you to make the questions and the tasks and everything. So today I'll be giving you chances. But more than that, considering all the requests from many of your viewers for the transcripts, I've made two different statements for each task. Okay, so the first explanation of the task will be for beginners, and the second statement will be for more advanced speakers. Okay, so both the sentences will be correct. You can choose whichever one you want to. So I have created two different ways of sentence construction for each task, which will be helping you in a bit more easier way to construct the sentences in an easier way. So that's what we are going to do here, and this is the case note that we will be discussing. So before we get into that, it will be really good if you guys can comment on which place you're watching this from, so that I can decide on which language I need to stick on to the most. Okay. All right. So yes, this is going to be an interactive session as well. I'll be giving you chances to create statements, and like we always do, I'll give you the live corrections as well. And most importantly, the entire idea of this live is to show you how easily you can create statements, especially for the beginners. How easily you can create statements from the very on task which is given there. So that will be building your own confidence. When things are a little more easier for you to understand, and when things are a little more easier for you to create statements, it will be less nerve-wracking, so that it will be more easier for you guys to do that as well. So as I mentioned, I will be taking you through the entire case note, and this is kind of like a format of an exam question which was asked last month. Not exactly the same thing, but the context is similar. Okay, and the tasks were designed with reference to the case note which was asked for the exam as well. So this is an exam model 1, and we have 6 tasks here. So I have created 2 sentences for the first 5, and I'm leaving the last one for you guys. Okay, I should give you something, right? So I'll be leaving the last one for you guys, and I'll show you how you can do all these tasks in 2 different ways. As I mentioned, the first one will be for the beginners, and the second one will be for a little more of advanced people. Okay, so you can see totally the difference between these 2 sentences, how the easiest one is and how the little, not very difficult one, but little, elaborated one. Okay, yes. Anish Kurup, hello. Hi, Anish. Millie Jarish, good evening. Hi, Millie. Vishak Balagobal, hi. Jesli Jojan, hi, good evening there. Divya, good evening. Vinita, good evening. All right, so since we have a lot to discuss today, I think it will be better, we start with it. Okay, so let's go through the case note. You can read it along with me. So you can see the setting, which is given as a community health center. Do not jump into the conclusion that it is a non-case or an unknown case just by reading the setting, because you need to get that understanding while you're reading the background detail which is given here. Okay, so do not jump into the conclusion there, but you can get an idea, okay, where this conversation is taking place, where the nurse is, where the patient is. Okay, so you'll get an idea from that. So we know this is a community health center. Now let's read the details. You're talking to a 42-year-old software engineer. He takes warfarin for DVT. He and his family are planning for a trip to Australia, which is a 6-hour flight from his place. He has heard people saying DVT gets worse while flying. He wants to know more details. So we got a lot of information from that place, right? We got to know that he's a 42-year-old one, so you can decide on the suitability of language, like the accent or the entire modulation. You can decide on that there, and you know that he's taking warfarin for what? For deep vein thrombosis. And we also know that he's traveling to Australia. He's planning to travel to Australia, okay? And he's worried because he has heard people saying it gets worse while flying. And he's there to get more details about the entire thing. That means he wants to know about this. He wants to know whether this is true. Okay, so from this, we got a lot of information. It will help you to understand whether it is a known case or an unknown case. So since there is nothing mentioned like the examination was done or there was a prior visit or nothing is given, right? So it's a completely unknown case. So we got that detail, right? Now, coming to your task 1. Greet the patient and ask for the reason for his visit. Okay, so we have 2 segments there. The first segment is greet the patient, okay, and the second segment will be the reason for his visit, right? So these are the 2 things that you need to be considering here. So these are called the action words, and you guys know what are action words, right? So action words are nothing but it indicates what is the action you're supposed to do there. So what is the first action? Your first action is greeting the patient, and since it is an unknown case, you know how it is normally done, right? And here you can see you're supposed to ask for the reason for the visit. Okay, so your action word is ask. Okay, so you're asking. So this is how you identify your action words in each task. Now let's see, okay, how we can have an opening statement. So let's go to each task one by one. I hope it is visible for you guys. Alright, so this is the first task that we discussed. Greet the patient and ask for the reason for his visit. So the first statement, as you can see, we have 2 statements. The first one is for beginners, okay, it is the easiest way to create statements. The second one would be a little more difficult than the first one. No, I'm not saying that beginners should not attend it, I'm not saying like that. The second type of sentence needs a little more practice, okay, so it would be more applicable for people who are more practiced and more experienced doing role plays, okay. So this is a reference for the beginners as well. You can see how you can shift your easier sentences or simple sentences into a little more of complicated or a little more of elaborate ones, okay. So the first statement or the normal standard statement that you can use everywhere is, good morning, my name is Richa, I'm one of the registered nurses working in this community health center. We got this detail from the background information, right, the setting as well as the background information. May I know the reason for your visit? Or you can ask, how can I help you? Okay, that is this part. Okay, so if I show you a little more in a broken way, like greeting the patient, you're doing this, good morning, and you're stating your name and you're saying who you are, that is your role, you're saying who you are, that is the registered nurse, and you also mentioned this setting, that is the community health center, okay. So by that you will finish your greetings. That is end of the greeting. And after that, we are supposed to ask the reason for the visit, right? So we are asking, may I know the reason for your visit? Now, if you look into the sentence construction here, instead of ask, I just used may I know. Okay, I replaced ask with may I know. Then I use the same statement here, the reason for, and his was changed to your, because you are referring to that person, right? So when you're talking to that person face to face, you have to use the your thing, okay? The pronoun has to be changed to your, so you're using the same statement. The only change that we made here is the his was changed to your. That is the only change that you have to make, okay? So you can say, may I know the reason for your visit? Or you can replace it with, how can I help you? So this is the easiest way of constructing your opening statement, okay? I hope that's clear for you guys. Now, if you want to change it and if you want to look a little more cool, okay? If you want to show that you have good language skill, your lexical resource is amazing, if you want to kind of like show off a little bit, you can try the second one, okay? You can use, good morning, I'm the registered nurse on duty today. Please call me Richa. You seem to be worried about something. Is there anything I can do to help you? Okay, so the reason why I'm telling you, you can use different statements like this is because if you are using the same repeated sentence construction from the examiner's point of view, he will be hearing the same thing like on a loop. He will be hearing the same thing over and over again. And when you go there, and when you use a different statement, you will be noted. Okay, that shows that yes, you have your own unique way of sentence construction. So it's always better that you do this, because there is no script for OET speaking. It is not mandatory that you have to follow these statements like that, like this. So you can use your flexibility in constructing statements there, okay? So this one looks a little different from this one, okay? I'm not saying this is a very well-versed statement, yet it is a simple one, but still a little different from the previous one, okay? The previous one is very easy. You're just asking, may I know the reason? Here you're changing it. You're changing and you're saying you seem to be worried about something. Is there anything I can do to help you? Okay? So instead of asking, how can I help you? I just twisted it to, is there anything I can do to help you? Okay, so I hope the opening statement is clear for you guys. All right, so this is how we are going to start our first task. Moving on to our second task. Now it becomes a little more lengthier. Okay, yes, so second task says acknowledge his concerns and gather information about his diagnosis and treatment regime. How long medications? I hope the meaning is clear for you guys. The first part, again, we have two segments here. The first part is nothing but we have to acknowledge his concerns, okay? Because when you ask the patient, how can I help you, in the previous task, the patient will tell you his concern, right? So you have to acknowledge that concern and then you have to gather information. So what are your action words here? We have two action words. The first action word is acknowledge. The second action word is gather. Okay, so that is our action word. Now we know what we have to do, right? Now let's see how you can acknowledge the concern. And what is the concern of the patient? Suppose the patient told you, I have been diagnosed with deep vein thrombosis and I'm planning to fly abroad to Australia, which is a 6-hour flight from here, with my family. And I've heard many people saying that it is very risky to fly if you have deep vein thrombosis. So I want to have details about it, okay? So this is the explanation told to you by the patient. Now let's say the easiest way, okay? I'm telling you the very easiest way to respond to this particular concern of the patient. The first way of doing it is, definitely I'll help you with all the details. The patient said, I want to know more details about it, right? So you can simply say, definitely I'll help you with all the details. All right, so that is acknowledging. You completed the acknowledgement part. All right, now let's see the next part. If you don't mind, please tell me, how could I address you? This is an extra part that I have added here because so far we don't know the name of the patient, right? We haven't asked it. So we need the name to refer to the patient and we need it for documentation as well. So you need to ask the name of the patient, so you can include it here. So you can ask, if you don't mind, please tell me, how could I address you? All right. So the patient told me, please call me Mr. X, suppose. So you're saying, all right, Mr. X, before proceeding further, I would like to collect few details about your condition and the treatments. Can I? Okay. Now, if you look into this portion, gather information about his diagnosis and treatment regime. Okay. The extra addition that I've done here is, before proceeding further, I would like to. This is a phrase which I've used, which is not given anywhere in the role play card, but you guys are familiar with it. You guys know it, right? It's a common thing that we use all the time. So you can use it here. Before we proceed any further, I would like to ask you some questions. So instead of that, what I did is I wrote collect few details. Now, how I changed it. Gather. Another term from gather will be collect. Details, few details. Information can be replaced with few details. About what? About his diagnosis was changed to about your diagnosis. And the treatment regime was changed to and the treatments. And then I asked a short question, can I do it? Okay, so it's as simple as that. You just need few phrases like this, which you can use everywhere according to the context, and then you need to know the synonyms of certain words. And if you know the synonyms, you can create new statements from the very basic structure given there. Okay, so again I'm telling you, you're saying before proceeding further, I would like to collect few details about your diagnosis and the treatments. Alright, can I, or shall I, may I? Okay, that's how you can do that task. Alright, now let's look into a little more elaborated version than this. Okay, the second task in a different way. Okay, I'm sorry you're having this problem. Let's see if there is anything we can do to help the situation. I'm very sure this is something new for many of you guys, and most of you might not be using this as well, but this is a very beautiful acknowledgement statement that you can use. Okay, let's go through it once again. I'm sorry you're having this problem. His problem is he has DVT and he's concerned about flying because he's taking warfarin and he's worried about the contraindications of that. So you can say, I'm sorry you're having this problem. Let's see if there is anything we can do to help the situation. Okay, that means instead of saying I'll help you with all the details, I just made it a little more elaborated by saying let's see if there is anything we can do to help this situation. Really nice acknowledgement, right? Make a note of it. Try to use it when the next time onwards when you're doing a role play. Okay, so that is acknowledgement. We finished the acknowledgement. Now I need to ask the name. If you don't mind, please tell me how could I address you. A replacement for that. By the way, what would you prefer to be called? Because you're having this conversation, right? Let's see if there is something I can do to help you. By the way, what would you prefer to be called? Okay, it goes like that, as a loop, as a continuation. Okay, not a loop, as a continuation. So he's saying, yeah, call me X. Okay, you can say, well, Mr. X, from what you have said, okay, I understand that you're planning to fly to Australia with your family. However, you're concerned about your DVT. In order to help you in a better way, I need to get a clear picture of your situation. I mean, I need to ask you a few questions about your diagnosis, that is DVT, and the treatment regime you follow. Once I have a clear idea, I'll be able to do the necessary for you. So shall I? You see the difference there? The sentence construction is nice. Okay, it is really different and you will stand out. So what I've done here is I will use the connection method. The connection method is nothing but you're connecting the information which you already have about the patient to the next task. Okay, so from where did I get this information? I got this information from the first task. When I asked the patient, how can I help you? The patient told me, I'm worried about my DVT, I'm flying to Australia with my family and I'm really worried about all those things. So I'm just connecting all those information, the cues given by the patient, and I'm clubbing it together in the next task. And this will add your score for understanding the perspective of the patient. That means you are actually listening very carefully to all the cues told to you by the patient and are using all those information in your explanation. Good to go. Okay, so this is how you can do this part. We have not finished task number 2. Okay, we have only reached till this part. Okay, this is called first line of a task and you have only done the first line explanation so far. Now comes the major part, asking questions. Okay, so this is otherwise, okay, this part, before proceeding further, this part is otherwise known as signposting. It is called signposting, which means you are indicating the patient that there is a change. There is a change or a deviation in your topic. Alright, so that is done. I hope it is clear for everyone. Okay, if you have any questions or concerns, feel free to comment. Okay, do you want me to zoom the screen? Is it clear now? I hope it is visible. Yes, I can see many people joining. Okay, hi Tess, hi Jyoti Lakshmi, Rinsi, Divya. Divya, I hope it is clear right now. Okay. Yes, so if you guys have any questions or any concerns, make sure that you remember all those points, and you can ask me towards the end of the session, because I'll give you 5 or 6 10 minutes to discuss the doubts that you have. Okay, so this is how you will do half part of task number 2. Now we are going to ask the questions. Okay, that is the most interesting part, also the trickiest part, because a lot of students make mistakes there. Okay, when I personally take the speaking sessions, I kind of like hear a lot of people getting confused with did, do, does, are, or have. People are so confused about questioning, so you really need to work on it. You need to ask your personal tutors or anyone about it, and make sure that you're very clear about how to frame questions. Okay, because when you ask questions, that particular statement is standing alone, and if you make grammatical mistakes there, it will be noted very quickly. Okay, so make sure that you're very, very careful about it. So let's see how we can create questions. Okay, so we have 2 things to be noted. Okay. So the first question was how long, okay, and the second thing that you have to inquire is about the medications. Now this how long is referring to the duration of the diagnosis. You have to be careful about it. There is a difference between duration and timing. Okay, people always get confused about it. Duration is nothing but, duration is since when the patient is experiencing this condition, like since when he had all the symptoms, like the time gap. Timing means how frequently it happens. Okay, so do not get confused about it. So how long means like since when he had it, and medications, whether he is following all the regime or the medications or things like that. Okay, so let's see how you can ask questions, and again I have 2 questions for each one. Okay, so let's see the first one. How long? So this is for beginners, because that is easy for you to remember, and for practice. Once you're good with your practice, once you're very thorough with these statements, you can shift to the next part, okay, which will look a little more different. Okay, the first one, how long have you been suffering from DVT? Simple question, right? How long is there? You need to know the question framing, the framing of the question here. How long have you been suffering from DVT? Okay, the second one is very different. Okay, and I have never seen many people using this one. So the second one is, when was the test run that confirms the diagnosis? See, it sounds really nice, right? It shows that you have a really good language base, and also it shows that you're very good at it. Okay, when was the test run that confirmed the diagnosis, which means when did you do the test and when was it diagnosed? It's another way of asking it. So learn this question. If you can learn it and use it appropriately, good. Well and good. Okay, so when was the test run that confirms the diagnosis? Okay, or you can say when was the test run that confirming the diagnosis, both are correct. Okay, so that is how you will ask how long. Moving on to medications. Do you take blood thinners as prescribed? So we all know that he is taking warfarin, right? So you can use warfarin or blood thinners. Instead of warfarin or anticoagulants, I would suggest you to use blood thinners. Okay, a little less complicated like anticoagulants, right? So you can ask, do you take blood thinners as prescribed? That is one way of asking it. Another way of asking it is, do you take all the medications you were prescribed? Both are simple. Okay, so learn these 2 styles. So by this, we will again come to the half of task number 2, because it is not just done. Once you ask questions, it is always important, it is significant that you give a summary of what information you gathered. Okay, you need to cross-check with the patient, and you have got a score for that, which comes under the criterion information gathering. Okay, it's important. So make sure that you are actually giving a summary of all the information that you have collected from the patient. You're cross-checking it, and you're also checking whether there is anything that you missed out or whether there is anything the patient missed out. Okay, so let's look into the summary. The summary says, thank you for your cooperation. Okay, you can say like that, thank you for your cooperation, or you can say your cooperation is well appreciated. See, there is a difference in that, right? Thank you for your cooperation. We're tired of hearing it. Yeah, we use it all the time. We say, oh, thank you so much for answering all my questions. Thank you for your cooperation. It's a very, very common thing. So instead of that, you can say your cooperation is well appreciated. Okay, different sentence construction. Then you can say, I got a clear idea about your situation now. Okay, which means that once after talking to you, I'm clear about your condition right now. Based on our conversation, I understand that you were diagnosed with DVT about 1.5 years ago and you are on blood thinners. Okay, so about this 1.5 years ago, you can ask that question too, okay, because when you asked how long, right, the patient will say, yeah, I was diagnosed about 1.5 years ago. So from that information, you can use this. So again, just a recap, you can say, your cooperation is well appreciated. I got a clear idea about your situation now. Based on our conversation, I understand that you were diagnosed with deep vein thrombosis about 1.5 years ago and you are on blood thinners. Don't stop there. You have to ask a question. You can ask a question like, is there anything else you would like to add? I hope it's legible for you guys. So you can ask a question, is there anything else you would like to add? Okay, which means we are just reconfirming that the patient didn't miss out anything as well as you didn't miss out anything. Okay, cool. So that is the summary. I hope the summary is clear for you guys. Okay, yes. All right, moving on. Let's look into the task number 3, which is a pretty lengthy one, I guess. Yeah, because you're giving an overview and all. Okay, yeah. So let's discuss that. Okay, so task number 3 says, give an overview of DVT and explain the possible risks involved while flying. Clot in a deep vein needs care to avoid clot breakage. Blood clots can loosen and lodge in the lungs. Immobility, higher risk of DVT while flying. You have to be careful here because you are actually talking about 2 things here, okay? And the bracketed details, it has been given respectively, but if you do not read it carefully, you might get confused. Okay, which one is referring to which one? All right, because since 2 information is being said here, because we are explaining about DVT, we are giving an explanation about deep vein thrombosis as well as its risk involved with flying. Okay, so you can see 2 different informations given here. So do not get confused. Make sure that you're reading it carefully. Okay, so let's break it down. The first one is give an overview of DVT. Okay, and then you have to explain, that is our action word. What do we have to explain? We have to explain the possible risks involved while flying, and that details is given here. Okay, so let's see the easiest way of creating it. All right, so sentence goes like this. I would like to give you an overview of DVT. Give an overview of DVT. Okay, this is for beginners. The simple way of creating it is just add I would like to. I would like to is a common phrase that you use all the time in the role play, so you guys know it, like before proceeding further. So use it here. I would like to what? Like to give an overview of DVT. Same thing. If you want, you can change it. Okay, I would like to provide an overview of DVT, or I would like to explain what is DVT. Different ways of doing it. You just need to use the synonyms. Okay, and tell you the possible risks that can be expected while flying. Okay, so this particular statement from here till here, it is called the explanation of the first line of a task. And what is the first line of a task? A first line of a task is the first line here. Okay, from this give till flying before the brackets. So that is the main thing that we are elaborating, right? Topic sentence, kind of like a topic sentence. So you have to give an explanation for the topic sentence before you get into the task explanation. So here we are saying, I would like to give an overview of DVT and tell you the possible risks that can be expected while flying. Okay, explain. Here, tell you the possible, right? I changed. Here it is explain the possible risks. I changed that to tell you the possible risks. And instead of involved while flying, I just changed it entirely to risks that can be expected while flying. Involved, I changed that to something can be expected. It's not the exact synonym of involved, but still kind of the similar meaning. Okay? And then you're starting with DVT. You're saying DVT is a condition in which, okay, we are going to explain, right? So this is another statement that you guys can by heart whenever you have to explain a condition. Okay, this is a condition in which blood clots are formed in a deep vein. clot in a deep vein, right? So I just included a term formed. You can say blood clots are formed in a deep vein. And then you're explaining. These clots can be seen in the lower leg, thigh or pelvis, or sometimes even in the arm. This is an extra statement because you might be knowing something about it, right? You can use that information. If you're very sure that that statement is correct, then you do not have to worry about using it. You can use it here. So, well, I was explaining about DVT. I know, okay, DVT happens here. It can be seen here. So I use that statement there. So that is how we do it. These clots can be seen in the lower leg, thigh or pelvis, or sometimes even in the arm. Okay. In your case, you told me you have it in your right leg. Okay, so this can be an information which was told to you initially. When you ask the patient, how can I help you? The patient is telling you, yeah, I was diagnosed with the DVT in my right leg. So you will get that information from there. You can use the connection method, the connectivity method, and you can remember that point and use it here. In your case, you told me you have it in your right leg. It is not a very serious condition. However, it requires proper care to avoid breakage of clots, as it can get lodged in the lungs. Okay. When it comes to flying, being immobile for long hours increases the risk of DVT due to lack of blood flow. Therefore, it is important to take care of yourself and take precautionary measures while flying. Is it clear to you? Okay. So this sentence construction is not very complicated. I constructed the statements directly from the information given here in the bracket. Okay. You just explained like it is not a very serious condition. However, it requires proper care to avoid clot breakage. Okay. Because it can get lodged in the lungs. Okay. That is how I explained it. And then again you're saying when it comes to flying, because we have the point here, right? We have the point risk involved while flying. So I'm saying when it comes to flying, if you're immobile, immobility means you're not moving, you'll be sitting in a position for a long time. So you're saying if when it comes to flying, if you're mobile for a long hours, it increases the risk. Higher means something increasing, so you can say it increases the risk of DVT. Okay, so that is how you can simply create a statement without much brainstorming. Okay, it's a very easy way to do that. And also make sure you ask this question. Is it clear to you? It is very important, okay, because you have to check whether the patient is understanding what you're saying. That is another assessment criteria. Okay, it comes under information giving. Okay, it comes under that. You have to check whether the patient understood your point. Okay, so you have to ask this question, is it clear for you? Okay, or clear to you? So that is the easiest way. Okay, now if this is the easiest way, now let's look into the advanced one. Okay, yes, I'll just quickly take you guys through that. Well, Mr. X, I understand you're really worried about flying given the circumstances. Please be relaxed. To make things clear and easy for you, I would like to give you an insight about DVT and the risks to be expected while flying. To begin with, could you tell me what you know about DVT? Yes, the patient will explain something because he has been suffering it for the past 1.5 years. So he would know something, right? So he would say something, yeah, it's a clot formation, blah, blah, blah. He'll give you the explanations and he can say, yeah, that's right. As I have said, deep vein thrombosis is a medical condition that occurs when a blood clot forms in a deep vein. These clots are usually seen in the lower leg, thigh or pelvis, but they can also occur in the arm. You need to be careful dealing with DVT as there are possibilities these clot break. It's not breakage. There are possibilities these clot break. If it breaks, there is a high chance that it might get lodged into your lungs, causing further complications. You do not have to explain about pulmonary embolism. You don't have to use that term here to freak out the patient. You can say further complications. Okay. Therefore, you need to be extra cautious while flying, as you will be mobile for a while, causing poor blood flow. Mr. X, please don't worry. I can help you with ways to control the intensity of your condition. See? Yes, it looks a little difficult, with different words, different sentence construction, everything, but with regular practice, trust me, you guys will be able to do it. Okay, there is nothing complicated about it. I just said I understand you are really worried about flying given the circumstances. Given the circumstances means we're talking about the condition. Okay, the circumstance means the situation which she is going through. That is called given the circumstances. But we are saying please be relaxed. Okay, to make things clear and easy for you. Okay, I would like to give you an insight. Insight means you want to give a detailed explanation, or you need to make him understand detailing. Okay, so insight about DVT and the risks to be expected while flying. To begin with, use these statements. To begin with means to start off with, initially, okay, or firstly. Could you please tell me what you know about DVT? Now, this particular portion is very important when it comes to an assessment criterion, that is information gathering. We need to know what the patient knows about the condition. We need to know whether the patient knows any false information, or whether the patient has any wrong assumptions about the condition he is experiencing. So we need to make sure that it is not happening there. Okay, so for this you have to ask this question whenever you're about to explain a condition or a diagnosis. Always make sure that you ask the question, do you know about it? Have you heard about it? Okay, questions like that. Or could you tell me what you know about it? All right, so that the patient will tell you, yeah, this is what I know about it. And if the information is wrong, then you'll have to say, well, I'm afraid that's not the right thing that you know, that's the wrong information that you have. Let me make it clear for you. Okay, but in this case, since our patient has been suffering from this condition for the past 1.5 years, we can say, okay, he will say, yes, I'm having clots. Okay, so we can say, yes, that's right. As we have said, deep vein thrombosis is a medical condition that occurs when a blood clot forms in a deep vein. Now, if you ask me if the patient knows about it, why do I need to explain it again? You have to. Okay, that is your task. You have to reconfirm. That is this part. Okay, as you have said, you're reconfirming it. Okay, and you are explaining all the points. And you also, in the previous sentence also I showed you this. You can use this extra statements where you're saying these clots are usually seen in the lower leg, thigh or pelvis, but they can also occur in the arm. And then you need to be careful dealing with DVT, as there are possibilities this clot break, not breakage, okay, break. And if it breaks, there is a high chance that it might get lodged into your lungs, causing further complications. Therefore, you need to be extra cautious while flying, as you will be immobile for a while, causing poor blood flow. You see the difference here? Because in the previous statement, I've said like this: when it comes to flying, being immobile for long hours increases the risk of DVT. See the difference here? Okay. While flying, as you will be immobile for a while, causing poor blood flow. This is the difference in sentence construction. Okay. Mr. X, please don't worry. I can help you with ways to control the intensity of your condition. So this is how you will do your task number 3. I hope it is clear for you guys. Okay. Yes. So moving on to our next task, that is task number 4. Inform the patient to look out for potential signs and symptoms while traveling. Pain or tenderness with no explanation, swelling of leg or arm, redness on the skin that is warm to touch. Okay, so these are the things that you have to use it. Alright, so let's look into the easiest statement, the first statement here. Most important thing you need to note while flying is that inform the patient to look out, right? So I'm using a statement to explain. Most important thing you need to note while flying is that you have to look out for potential signs and symptoms. You have to look out, right? So you just have to use you have to look out here. You have to look out for potential signs and symptoms such as, and you're explaining the points given in the bracket, pain or tenderness with no explanation, or swelling on your right leg, even redness on the skin, or if the skin is warm to touch. In case you notice any of these symptoms, it indicates DVT. If any, you need to have medical intervention immediately. Are you following me? Okay, that is how we can explain it. And the reason why I did not use arm here is because the patient told he is only having in the leg, right? So you don't have to use it again, the arm part. So that is the easiest way to do that. Now, if I break it down for you guys, this much is clear. Then coming from this part, such as pain or tenderness, with no explanation, I use the same portion which is given there, no changes, okay? Or swelling on your right leg, okay? Swelling of leg, I changed that to swelling on your right leg, or swelling in your right leg, okay? Even redness on the skin, I just added even here. Even redness on, the was changed to here because you're referring to that person, right? On your skin, on the skin, or if the skin is warm to touch, or if the skin is warm to touch. It's the same here. Okay, so most of the parts are taken from the same sentence which is given here. I just made some additions. That's all I have done. Okay, so that is the easiest way to do it. Now let's look into a little more complicated way of doing it. Okay, Mr. X, there are a few things you need to know before flying. Normally, DVT patients who have been diagnosed recently are not permitted to travel within the first 4 weeks or unless the doctor permits to. Extra information. If you know additional detail which is not given in the bracket and you're sure about it, I'm saying that if it is sure, then you can use it, okay? Then I'm feeling like, no, okay, yeah, for the first 4 weeks they can't travel, so I'm using the same information there. In your case, it's been more than a year. So, with proper precautions, you can travel. Always watch out for potential signs and symptoms while traveling. If you experience pain or tenderness which cannot be explained, or if you notice swelling in your leg or redness, or if you feel warm to touch, you need to be more vigilant and ask for help. Is that clear to you? Okay, so that is how you can elaborate the previous statement. Okay, that is the difference there. All right. Yes, so I hope that is clear for you guys. If you guys have any questions, feel free to ask that, okay? Divya, really excellent explanation, ma'am. Thank you. I hope it is clear for you guys. Because many of you guys were asking for the transcripts. Okay, normally I just say the statements and you guys listen to it. Now, since I have kind of like a copy which you guys are watching right now, it will be more easier for you to understand. So I hope it is a little more easier for you guys. All right. So shall we move to the next one? The 5th task. Oh, okay. It is kind of like separated. All right. The 5th task says, when asked, explain the precautionary measures to be taken, compression stockings, standing and stretching every few hours, watching for symptoms of DVT, exercising the calf muscles while sitting, blood thinners as prescribed. Okay, so these are the precautionary measures he has to take while he is flying. So let's see. Whenever you see this portion, when asked, or when the patient arises the concern, okay, something like that, that means you have to lead the patient. Whenever it is when asked, you have to lead the patient, okay? That means when asked means when the patient asks you, okay? And if the patient has to ask you something, that means you have to lead the patient to that area so that the patient will ask you. I hope you understand the connection there, okay? So you have to ask a question, do you have any more concerns, okay? So the patient will tell you, yeah, I have one more concern. Another way of asking that is there anything else you want to ask me? Okay, the reason why I'm giving you 2 different forms of these particular statements are because you have 2 role plays for the exam. So if you guys know 2 different statements, you can use the different statements in both role plays, right? You don't have to repeat it. So learn it. Do you have any more concerns? Is there anything else you want to ask me? Okay, then the patient will say, yeah, so what are the precautionary measures? Okay, because in the previous task, you ended by saying like this. You said, I will give you some explanations, right? Also watch out for potential signs and symptoms while traveling. Okay, I didn't say that. Yeah, you have said like I can help you with ways to control the intensity of your condition. Okay, so that is what we are going to explain here. All right. So we are going to say the easiest way of explaining this is, I'll tell you some of the precautionary measures you can consider while flying. This part. I will tell you some of the precautionary measures you can consider. To be taken was changed to consider, okay, while flying. Extra word, all right. Yes, while flying. Please ensure that you wear compression stockings. If you try standing and stretching every few hours, maybe every 2 hours, blood circulation will be better. Most importantly, always look out for any symptoms as mentioned earlier. Symptoms we told earlier, right? Like warm to touch, pain, swelling, tenderness, etc. Mr. X, even exercising your calf muscles while sitting is also a good relief. And don't forget to take the blood thinners as prescribed. I hope you're following me. Okay, you see that? The portion which is given here, same thing which has been used. I have used the same format. I've just changed used few synonyms, replaced the words and added few other information. That's it. And the sentence has been created very directly from the same sentence which is given. Okay. Now let's look into the little more elaborated one. Mr. X, I know you're really worried about what to do. As I told you, if proper precautionary measures are taken, there is nothing to be worried about. I will help you with some of the effective precautionary measures. Keep compression stockings handy with you. It will be helpful to enhance blood circulation. You're explaining the importance of it, okay? Since it is a 6-hour-long flight, see, again, the method of connecting the information that you know. Since it is a 6-hour flight, you know that, right? From the beginning, you know that. So since you know, if you connect all the information, that shows that you are really good in dealing with the problems of the patient and you're listening very closely. Okay, make sure you stand and stretch in between, maybe every 2 hourly. Okay, and will you be able to do that? I'm breaking it down. I'm not going back to back with the explanation. After giving 2 suggestions, I'm asking the patient, will you be able to do that? So the patient is saying, yeah, I'll do that. Okay, and then I'm continuing. It is also important that you look out for the symptoms of DVT. I would also like to tell you that exercising calf muscles while sitting is something to be added. Okay, so while sitting is important or something like that. Okay, I would also like to tell you that exercising calf muscles while sitting is important. Most importantly, take your medications on time. If you follow all these instructions, you can control the intensity of your condition. Okay, so this is a little more elaborated way than the first sentence. All right, I hope that is clear for you guys. Now, I've told you I have 2 sentences each for the first 5 tasks, and I have showed you here, and this will be recorded and you can see this video on our FB page as well as our YouTube channel so that you can use it for a reference later. Okay, now coming to your chance, because today I didn't give much chance for you guys to create sentences like we normally do, so I'm giving you a chance. The last task, suggest consulting the concerned doctor about other preventive steps based on unique needs. Okay, that is your task. Suggest consulting the concerned doctor about other preventive steps based on unique needs. How can you do this? You guys can type in and I will look into it. Yes, I'm expecting sentences, all right. How can you do that? Suggest consulting the concerned doctor about other preventive steps based on unique needs. How will we do that? Yeah. Please type in your statements. you are suggesting the patient to consult the concerned doctor about other preventive steps based on unique needs. I know some words can be a little confusing here, but if you guys try to break it down, it will be easier for you to understand. Maria Albin actually asked me, what brings you here today? Is it okay to ask? Okay, initially, yes, you can ask, okay? Instead of asking, how can I help you? You can ask, what brings you here today? That's correct. Yes, please give me the statements. Is this task clear for you guys? You're not giving me statements because you didn't understand that. If yes, you can ask me to explain it. I'll definitely do it. Anyhow, I will definitely do it. But tell me what is confusing here, or give me the statements, like when we can discuss it. Let's see the different ways of creating the statements. Anyone? Okay, I've got a statement here. Ninu Ann, she said, Mr. X, I can say that you're overly concerned about your condition. Here, I would like to strongly recommend to consult the doctor, and the doctor will definitely explain certain preventive measures what you need. Brilliant statement. I really loved it. Good sentence construction, okay? Good job, Ninu. Divya is saying, if you need better clarification, you can consult a doctor and seek more advice. If you agree, I can make an appointment for you. Good, really nice. That's nice too. Okay, so any more statements? If you guys would like to send in more statements, it is more appreciated, because others can also see, and others will also understand different ways of creating it. So here, suggest consulting the concerned doctor. We are referring to his personal doctor, okay? Maybe his GP, or maybe the doctor who diagnosed him with DVT, okay? We are talking about that particular doctor, okay? Why are you suggesting to consult the doctor? Because we are suggesting him to check for another preventive steps based on unique needs. And what is this unique needs? Unique needs is nothing but each patient is different. Their body is different, right? Like, they have different like bodily things, like their vitals will be different, their body metabolism will be different, so everything changes. So a doctor will be the best person to give explanations based on the different things, based on different people. Like, what I mean to say is, each patient is different, so according to the differences the patients have, the doctor will be able to give you explanations or preventive measures which is suitable for that particular person's entire body metabolism, okay? So that is a unique needs. Each person will have their own unique needs. My unique needs of how my body reacts to a medicine, or how my body reacts to some particular thing, is not like how it is for you guys, right? So it differs, it is not the same. So if you talk to our personal doctor, the concerned doctor, he will be giving you more details which will be suitable for us personally, okay? So you're suggesting, so you can say that, the simple sentence what you can do is you can say that, I hope, you can ask, I hope I have clarified all the doubts for you. So I would also like to suggest you to consult your concerned doctor, or you can say GP, okay, for more preventive steps, okay, about regarding your unique needs. Based on, instead of based on, you can say regarding, okay? So again, I'll repeat it for you. I would like to suggest you to consult the concerned doctor for more preventive steps regarding your unique needs. And if you want, I can book an appointment with the doctor. Okay, that is how you can do it. Now, if you want to change it, there is not a complicated way of changing it, but still if you want to kind of like rearrange everything, you can try something like, I highly recommend you meeting your doctor who will be more experienced to provide you with explanations or preventive measures which will be suitable for your personal needs. Okay, something different like that. All right, so that is how we can do that. Okay, now coming to the conclusion. Oh, okay. I got more statements. Sonia is saying, I would suggest you to consult a doctor for getting other preventive measures. Good sentence construction, but a slight thing that I would like to point out. Instead of saying I would suggest you to consult a doctor for getting, okay, so you can simply say for more preventive measures. For getting other preventive measures, you can say for more preventive measures. Simple as that. Okay, that's a very simple statement. Good. Smita Petri saying, in addition, I would suggest you to consult your doctor to get more personalized advice. Very good statement, Smita. That's a brilliant one. Okay. All right. Okay, so that is how we can do it. Now, coming to the conclusion of this one. Okay, once you finish every part, you can ask the patient, so do you have any other concerns? The patient is saying, no, I don't have any concern. So, if you don't have enough time, if you feel like you're running out of time, we can say, well, in that case, thank you so much for your time. And as I mentioned, I'll book an appointment with the doctor for you. Okay, and you can finish off the conversation. But if you feel like you have enough time, okay, or you kind of like have few seconds left, like maybe 10 seconds or not 10 seconds, maybe like 20-30 seconds left, you can try giving a summary. You can say, so to go over what we have discussed today, you were diagnosed with deep vein thrombosis a year ago, and you are planning to travel to Australia with your family, and you're worried about the concerns. So I have explained I have explained what is DVT and the complications of it, as well as I've given you these precautionary measures to be taken. And as we have discussed, I will book an appointment with the doctor so that you can have a personalized conversation with him, and you can wind up the conversation. That is how you can do it. All right. So I hope this was clear for you guys, and I do expect your feedback and your suggestions. So based on that, I can prepare my next live or come up with the next content videos and whatever whatever is suitable for you guys. Okay. So since you guys requested for the transcripts, so I thought of doing it like this. So if you have more suggestions, you can comment. You can watch this recorded live session, because you'll get the recorded live session, which will be posted soon in our FB channel as well as on our YouTube page. So you guys can refer to that and post your valuable comments there. And if you like this one, please share and like, and I'll see you guys next time with another live. Okay, until then, take care. Bye bye.